As we age, our medicine cabinets often grow alongside us, filled with prescriptions to manage chronic conditions and maintain our health. But what if some of those very medications were quietly sabotaging our cognitive well-being? Research has uncovered a startling link between certain commonly prescribed medicines and an increased risk of dementia. Could your daily medication regimen be putting you at risk of losing your memories, your identity, and your independence? Discover the 9 surprisingly common medicines that have been linked to dementia, and learn how to protect yourself and your loved ones from the devastating consequences of medication-induced cognitive decline. Disclaimer: remember, the information provided is for educational purpose only and should not substitute informed medical advice or care. 1. Benzodiazepines. Examples: Xanax, Valium, Ativan. Benzodiazepines, or benzos as they're often called, are prescribed for anxiety, sleep problems, and sometimes muscle relaxation. These are the pills that calm you down, almost like a mental pause button. But when that button gets stuck, there can be lasting effects. Research shows that people who use benzodiazepines have a significantly higher risk, up to 50%, of developing dementia. Benzodiazepines work by enhancing a neurotransmitter called GABA, which reduces brain activity. This is why you feel calm and relaxed. However, this suppression of brain activity comes at a cost. Over time, your brain becomes dependent on the drug for calm, and your natural GABA function may be weakened. Studies have shown that this can lead to cognitive impairments and memory loss. Essentially, you may lose your brain's natural resilience, increasing the likelihood of cognitive decline. 2. Anticholinergics. Examples: Benadryl, Unisom, Ditropan. Next up, we have anticholinergics. If you've ever taken a pill for allergies, a cold, or an overactive bladder, it may have been an anticholinergic. These medications can seem like a miracle for symptoms, but come with risks that are rarely talked about. Anticholinergics block a neurotransmitter called acetylcholine, which is essential for memory and learning. This blocking effect doesn't just make you drowsy, it reduces brain cell communication. When acetylcholine levels drop, neurons struggle to talk to each other. Long-term use of anticholinergics has been shown to shrink brain areas involved in memory. A study even found that older adults using anticholinergics have a greater risk of developing dementia, especially if they use these medications frequently. Imagine trying to communicate with someone on a different wavelength. It's confusing and exhausting. That's essentially what these medications make your neurons go through. 3. Opioid painkillers. Examples: codeine, morphine, oxycodone. Opioids are lifesavers for those in extreme pain, but they also have a dark side. Aside from addiction, opioids can significantly impact memory and cognitive abilities. Opioids bind to receptors in the brain that modulate pain, but they also slow down cognitive processing. They depress the central nervous system, essentially putting the brain in a constant state of low energy, and over time, this can lead to memory issues. Recent studies even link long-term opioid use to a higher risk of dementia because the brain starts adapting to this sluggish state, impacting memory formation and problem-solving abilities. 4. Proton pump inhibitors, PPIs. Examples: Nexium, Prelosec, Protonix. Proton pump inhibitors, or PPIs, help with acid reflux and heartburn, but what they do to the brain is less known. Surprisingly, regular users of PPIs are at a greater risk of dementia. PPIs reduce stomach acid production, which helps ease reflux but also hinders nutrient absorption. One key nutrient impacted is vitamin B12, which is vital for brain function. Without enough B12, nerve cells struggle to maintain healthy connections. Additionally, PPIs alter gut microbiota, the good bacteria in your gut, and studies now show a link between gut health and brain health. This disruption can lead to inflammation, which is thought to contribute to cognitive decline. 5. Antipsychotics. Examples: Seroquel, Risperdal, Zyprexa. Antipsychotics are essential for people managing conditions like schizophrenia or bipolar disorder, but their impact on the aging brain is concerning. Research suggests that these drugs might accelerate cognitive decline, especially in older adults. Antipsychotics block dopamine, a neurotransmitter that helps control mood and reward. Over time, blocking dopamine can lead to brain shrinkage, particularly in areas involved in motivation, learning, and memory. In elderly patients, especially those with pre-existing cognitive vulnerabilities, this can fast-track memory problems and dementia. It's almost like dimming the lights on the brain, making it harder for neurons to fire up and stay engaged. 6. Statins. Examples: Lipitor, Crestor, Zocor. Statins are hailed for their cholesterol-lowering abilities, but for some people, they seem to come with cognitive side effects like memory fog. Could these drugs also play a role in dementia risk? Statins lower cholesterol, which we know is beneficial for heart health, but cholesterol is also crucial for brain cell health, forming the structure of our neurons. By lowering cholesterol too much, especially in the brain, statins can disrupt the cellular structure and impact neuron communication. While research is still ongoing, some studies suggest a link between statin use and cognitive problems. Think of it as trying to run a complex machine without enough oil. The parts just don't work as smoothly. 7. Antidepressants, tricyclics. Examples: Elavil, norpramine, Pamelor. Tricyclic antidepressants, some of the oldest drugs for depression, are effective but come with their own set of risks, especially for the brain. These medications affect serotonin and norepinephrine, but they also block acetylcholine, which we talked about earlier. Acetylcholine is critical for brain function, especially for memory. Blocking it can lead to cognitive dulling and memory issues, particularly in older adults. 8. Anti-epileptic drugs. Examples: phenytoin, carbamazepine, topiramate. Anti-epileptics are crucial for people with epilepsy, yet they have cognitive side effects that can add up over time. Anti-epileptics work by reducing excessive brain activity to prevent seizures. However, this dampening can also dull regular cognitive function. Over time, the brain adapts to this slowed state, leading to cognitive issues such as memory loss. Some studies show that long-term use may contribute to dementia-like symptoms in older adults. It's as if the brain becomes overcautious, constantly holding back even in moments when full focus is needed. 9. Sleeping pills. Examples: zolpidem, esopiclone, temazepam. Finally, sleeping pills. While they help people get a good night's rest, their long-term impact on cognition is more complex than we once thought. Sleeping pills interfere with REM and deep sleep cycles, which are critical for memory consolidation. When the natural sleep architecture is disrupted, the brain doesn't have the opportunity to process memories effectively. Over time, this can lead to memory issues, and studies now show a link between long-term sleeping pill use and dementia risk. Before we end this video, let's talk about certain lifestyle changes that have been proven to help protect you from dementia. 1. Prioritize mental stimulation. Challenge your brain by engaging in mentally stimulating activities like puzzles, reading, learning new skills, or even playing musical instruments. These activities strengthen neural connections and improve cognitive reserve, which helps protect against dementia. Studies suggest that lifelong learning and mental engagement lower the risk of dementia by keeping the brain active and resilient. 2. Physical activity. Exercise regularly, aiming for at least 150 minutes of moderate aerobic exercise per week. Activities like walking, swimming, dancing, and cycling improve blood flow to the brain and release hormones that support brain cell health. Combining aerobic exercise with strength and balance training is especially beneficial, as it reduces fall risks in older adults who are more vulnerable to cognitive decline following injuries. 3. Healthy diet. The Mediterranean or MIND diet. The Mediterranean diet, which is rich in fruits, vegetables, whole grains, olive oil, and lean proteins like fish, has been associated with a lower risk of dementia. This diet provides antioxidants, anti-inflammatory nutrients, and omega-3 fatty acids, all essential for brain health. The MIND diet, a hybrid of the Mediterranean and DASH diets, dietary approaches to stop hypertension, emphasizes brain-supportive foods like berries, leafy greens, nuts, and whole grains while limiting red meat, sugar, and processed foods. 4. Maintain social connections. Staying socially active can stimulate brain regions responsible for memory and emotional processing. Consider joining clubs, attending community events, volunteering, or maintaining a regular catch-up routine with friends and family. Forming new relationships and social bonds introduces the brain to fresh perspectives and conversations, which help boost mental agility. 5. Quality sleep practice. Good sleep hygiene by aiming for 7 to 9 hours of quality sleep per night. Poor sleep or sleep disorders, like sleep apnea, increase the risk of dementia because sleep is crucial for memory consolidation and the clearance of beta-amyloid plaques associated with Alzheimer's disease. Establish a consistent routine by going to bed and waking up at the same time each day, limiting screen time, and avoiding caffeine and alcohol in the hours before bed. 6. Manage stress effectively. Mindfulness practices, such as meditation, deep breathing exercises, and yoga, have been shown to reduce cortisol levels, a stress hormone that, in high amounts, can damage the hippocampus, a brain region critical for memory. Scheduling regular downtime for relaxing hobbies and nature walks can lower stress levels and support cognitive resilience. Limit alcohol and avoid smoking. Excessive alcohol intake can damage brain cells and increase dementia risk, so it's best to stick to moderate drinking, up to 1 drink per day for women and 2 for men. 7. Quitting smoking is also essential, as smoking accelerates brain aging and is linked to a higher risk of dementia due to its harmful effects on blood vessels and brain structure. Quitting has immediate and long-term benefits for both brain and heart health. 8. Protect your heart health. Controlling blood pressure, cholesterol, and diabetes is crucial since these conditions increase the risk of cognitive decline. Maintaining a healthy diet, exercising regularly, and taking necessary medications can help keep these conditions in check. Ultimately, protecting brain health. Regular health screenings also allow for the early detection of cardiovascular issues closely linked to brain health. 9. Protect your head. Prevent head injuries by using seat belts, wearing helmets when necessary, and reducing fall risks at home by keeping walkways clear. Even mild head injuries increase the risk of dementia, especially when they occur repeatedly, so it's important to prioritize safety in everyday activities. 10. Stay informed and curious. Engaging in lifelong learning by reading, exploring, and asking questions about the world stimulates the brain and encourages new connections that enhance mental agility. Staying curious and open to learning creates a dynamic foundation for brain health. By integrating these lifestyle changes, you can build a strong foundation for brain health, supporting dementia prevention and enhancing overall well-being. Medications can be life-saving and they can vastly improve quality of life, but the risks associated with long-term use, particularly in older adults, shouldn't be ignored. If you or a loved one are concerned, consult with your healthcare provider. They can help weigh the risks and suggest safer alternatives or lifestyle changes. Thank you for joining us on this deep dive into medication and brain health. Stay informed, stay proactive, and most importantly, stay curious about what you put in your body.